Everyone, welcome back to our channel. Again here, T.M.J. Third video. I think it's the most important video. It is the treatment. We talked about before how Joe interfered. We're talking about the diagnosis, how to make the diagnosis this time. In the third video, we'll talk about treatment. In James is, I show you here. Treatment first. Deprogramming. The job. What means deprogramming the job? What means this? That is the thing we're talking about. Deprogramming is isolate the bad dysfunction, isolate the dysfunction, the central nervous system. This device is called the body equilibrium device. Body equilibrium device is an important during the nighttime to annulate bad information central nervous system. That is very important to understand. It's something as we put an antivirus here, annulate the information to the central nervous system. Don't miss this video. It's a very important video. How to treat the T.M.J. We are here just talk about the treatment of the T.M.J, the temporomandibular joint, who is under T.M.D, temporomandibular disorder. Very different things. To start the treatment, as you know, the T.M.J it doesn't accept compression. Compression is very bad for T.M.Js. Compression is a very bad situation we have into our temporomandibular joint. Our temporomandibular joint is very, very important to understand that T.M.Js do not accept compression. Anything we have here to increase the pressure into the joint, start the disease, and to remember in the other videos, bad defense bruxisms. Then we will start to talk about the treatment of the T.M.Js. Treatment of the T.M.Js. Deprogramming the jaw. That's the most important thing we have to understand. Deprogramming the jaw. What means deprogramming the jaw? Deprogramming the jaw is some device patients wear at night to annulate the system. And in that case, the central nervous system receive new information, but nothing happened here. This is mainly the deprogrammation, deprogramming the jaw. Okay? The main objective of the M.P.R, the power protocol, functional postural rehabilitation, is deprogramming the mouth. That will allow good rehabilitation, and then we can have a good position of the jaw in the future. The bed, the body equilibrium device, is an oral appliance that for nighttime use it to deprogram the craniofacial system, but also eliminate the stress caused by muscle change, stress that the facial system is causing to the muscle, change. The bed is a very important treatment. It's just a device to annulate, just one size device to annulate the craniofacial system dysfunction. The bed device is adapted in the first section, and we leave the device work for 1 week, and then you can do any treatment necessary, any symptomatic treatment. After any treatment, the bed device has to be refunctionalized to maintain the craniofacial system deprogramming as before. You can see there are different parts of the device, curve of speed, the anterior guide, the vestibular shield, neuromuscular functions, the palatine support to make a stabilization. It's a very special device in a silicone, in a medical silicone material that the patient can wear, and they annulate the system, annulate the dysfunction of the system. This is the concept. Don't misunderstand it. There is not a therapy. It is annulating the system. Most of the symptomatology disappear. Why? Because when we annulate the system, there is not more information, bad information to the central nervous system, muscle relax, body relax, all the body is better. Use of the bed, and the bed device is sleep, but during exercises, prevent injuries and do better the performance. And anytime you have exaggerated stress, you can use it. Obviously, if you work a lot of time in the computer and you don't have to talk, use the bed device. It will help your body a lot. Then we see some clinical cases. In clinical cases, you see there one patient with a very bad situation in the mouth, lot of teeth removed, bruxisms. And look at here. Before the treatment, after the treatment. 4 kilos overload, body center is very bad deposition, bad body weight distribution. Look at here. After the device, 0 kilos, better the body center, better the body weight distribution. After the programming, jaw is centrated. Now we have to reprogram the jaw. The next step is to put the jaw in the right position, no compression. In that position, we will build the functional occlusion. We're talking about now reprogramming of the jaw. We call that progressive mandibular reprogramming. We did with the functional postural reprogramming that can reprogram, protect the system. Sometimes we use functional postural microplanes that just reprogram the jaw position. The progressive mandibular reprogramming is a functional method to obtain the centered position of the jaw, and the most important thing is the neuromuscular vertical dimension, where the whole system is in balance with the rest of the body. The reprogrammer is using during the nighttime. With this, slowly, we will find the vertical dimension. You can see there, the reprogrammer is in the lower arch, and that is like an overdenture over our teeth, founding the exactly jaw position. And then, before finish, we see a clinical case. Young boy that the surgeon want to operate. He said it's not option, another option. Look at what happened. You can hear the reprogramming before and after, how the jaw take new position. The reprogrammer, that was jaw position, actual jaw position. Now, no surgery, just orthodontic treatment to make an teeth alignment. Teeth alignment. You have to measure the space, take a good space, and then build the reprogrammer. As you can see, never do surgery before. Never at all. Try first. If it's not possible, something functional, then the surgery. And then we finish the third video, the third part. Treatment. Reprogramming T.M.Js. With this, you can build a very good functional occlusion, right place, vertical dimension in balance with the rest of the body. If you like the video, do a click in like, subscribe the channel. You can make grow the channel for everybody. It's a free channel for patients and dentists and all medical sciences. If you like it, subscribe, click the bell. You click in the bell downstairs, down there, the bell, down there, bell, subscribe, like the video, and I see you in the last video of the series that can be prevention. Bye-bye, everybody.